Hey guys, Jordan here. Today we're going to talk about how important health screenings are for your body as well as for your family members. I know that you're probably thinking, how in the world can it be important for your family members and why does it matter to you? Well, I think the biggest thing we need to take away from this today is just focus on the different screenings or health screenings that us as individuals need and how important it is to keep up with your family members, because sometimes, and I deal with a lot of men more so than women in my urology office, but a lot of the men, sometimes you see that their pride is a little bit too much for them to where they don't feel comfortable enough going to the doctor's office, and they say, oh, I'm totally fine, I have no symptoms, I don't have any reason to go to the doctor, and I'm fine. But I want to really show you possibly or explain to you some things that can happen or things that you might not think nothing of and that could be something. So just listen out for a second. So, like I said, I work at a urology office, and with urology, if you're not familiar, we deal with a lot of patients that have urinary retention, which means that they are not able to use the restroom on their own. They're just having some issues with being able to void. We also have some patients that have just simple UTIs, which is urinary tract infections. They also could have prostatitis, which is an inflammation of their prostate, which is the gentleman, as well as enlarged prostates. They have prostate cancer, bladder cancer, kidney cancer. So if you can think about urology is when you're dealing with your kidneys and your bladder and your prostate. So those are things that we deal with. Now, I think what I'm trying to get aligned with right now is to explain how important your health screenings are. And you're probably wondering why I'm explaining why I work at where I work to bring up to health screenings, okay? So why I say this is too often I see bukus upon bukus of patients that come in for their very first time, and they're coming in because their primary care has referred them to our office, and they are having concerns of not being able to void completely or empty their bladder out completely, or having issues with burning when they pee, or sometimes no issues at all. Their blood work is just something flared up or that's out of whack from their primary care physician. And so all they do is they refer them to our office. And so I should elaborate and say most of the time, most of our referrals come from men. So our male patients is 90% of our clinic. And if you're not familiar with your anatomy, the anatomy for female and male, the male parts are the only difference between a female and a male part in the bladder aspect, I should say, that's between the bladder and the urethra, is the prostate. So the prostate is only for a male patient. And with that being said, if that prostate ends up getting enlarged, whether it be prostatitis, which means itis at the end of any word usually is inflammation, right? So prostatitis, where his prostate is enlarged. He could also have benign prostatic hypertrophy, which is BPH, which just means benign means negative, enlarged prostate tissue. Sometimes it could just in general be the fact that they might have prostate cancer. So a lot of our gentlemen will come in with just some simple thing as whether they have urinary retention, or they might simply have blood work that came back from their primary care physician, and it says their PSA, which is their prostate level, is elevated. So a regular prostate level or PSA result is 0.0 to 4.0. So let's just say it's above 4.0, right? Or it's on the higher end of a PSA. Those patients get referred out. Sometimes they get managed by medications from their primary care physician, but most of the time their primary care physician likes to go ahead and refer those out, so they have a specialist to look at that. So our surgeons will see them. And, we will have our rectal exams that our patients will have sometimes. And just, going by the symptoms and the blood work, sometimes the provider will see fit if they have any family history of prostate cancer, if they had any excuse me, history of prostate cancer for their families, if they've had any other issues with their prostate in the past, going off their symptoms, going off their blood work. So there's multitude of things that they'll go off of to see, what's the bottom line. Now, this is part of a health screening. When you go and get your yearly checkup, sometimes gentlemen will not think nothing about it. They'll get their blood work if they make it to the doctor. And I encourage you wives and your girlfriends and just you in general as a female, you just make sure you take care of yourself and make sure that you do, if anything, if you don't need to go to the doctor because you're not sick, you're not having any issues, at least do a regular checkup of your annual. So that when they do that, they will make sure that all your blood work's up to par and make sure everything is taken care of, because at any point in your life, something can change with the flip of a hat. And it's easier to take care of and manage when it's something right then when they find it, versus you come in 6 years later because you've never had an annual and you just said, I have not had an issue, and all of a sudden you have an issue and you're like, let's go to the doctor. And then when you go to the doctor, it might be unmanageable because it might be years growing of cancer or just high cholesterol or high blood pressure or anything that, we can manage if you just keep an eye on it yearly. So what I'm trying to say is if you get those, your husbands, your boyfriends, however, if there's any symptoms and anything progresses out of that, encourage them to follow up with their primary care physician, or encourage them to follow up with their referral to a specialist, because sometimes, even though it might not seem something like very big, sometimes those can be concerning issues if you don't look into it, and it can progress. I've had multitude of patients, and I know I've said that once before, but it's very true. Excuse me. So I have multitude of patients where they'll come in my office, and I actually handle our surgery department up in urology and get the patients prepped and ready for procedures, and they're here for a biopsy. So when you have those symptoms and you're having the blood work that comes back, or the family history, or certain things that the surgeon deems that they need to have a prostate biopsy to make sure they don't have prostate cancer, they'll come to me and we'll go ahead and get them prepped and we'll proceed. And then sometimes it's negative. Sometimes they have benign BPH, benign prostatic hypertrophy, where they're enlarged prostate and it's nothing. It's no cancer, which is awesome. But then sometimes those patients that simply didn't think nothing of it, right? They'll come in, we'll have the biopsy, and it's cancer. Well, at some time they have treatment, sometime it's not, depending on what age. There's a lot of things that come into it. So if you can just take care of yourself and your health each year, if that's the minimal that you'll do, that will help with making sure that if anything comes about, it will be able to be managed. Now, granted, I understand that there is some patients, there is some people out there, and just in general, it's your body. Things happen even before a year. But just be mindful that you only have one body, and you have to take care of it. You have to make sure that you're keeping it up, whether it is drinking enough water each day, making sure you are exercising at the extent that you're able to, making sure you eat the right things. I mean, I am the first to say I definitely don't eat the right things or exercise or drink enough. I mean, I'm human. We're all human. But I think that the best thing that you could take away from this is to know that things can happen and flip of a switch, and things sometimes are scary. A lot of our patients that come in, they don't like having a rectal exam. I know I'm talking about a lot of men, but that's what I deal with most of the time. And a lot of them are or do struggle with themselves to go and let someone take care of them that way. But it can be a simple rectal exam, and that can just tell the doctor that whether it's something or not. So I think that's something that if you can just catch it before it happens, that will be a lifesaver to some extent, depending on each patient's case. So I think today, just kind of go and think about, when's the last time I had a health exam or a health screening? Make sure that you're making every point that you need to take care of yourself and even your family member, because you don't want it to one day just pop up and man, I hated that I had this happen because I could have managed this. And for you ladies, I know that I talked about men a lot, but, and this is ladies and men, right? For ladies in general, do pap smears. Make sure you do your breast exams. Those things can happen a flip of a switch too. We had a lady at my work. She ended up having her regular annual exams. She was regular. And she ended up having a tumor come up on her breast. She had to have chemo. You know, so even when you are doing your regular exams, but they said if she didn't come when she did and she just let it go, they said they wouldn't been able to manage it. So those simple things, those simple tests, those simple steps, you know, taking a day to go and take care of yourself is going to mean a lot more. And your families are going to love you for it so that you could be here for them and your kids and your grandparents. And those are the things that mean the most. So today, take care of your blood pressure. Make sure that you're eating the right things, drinking enough water. Make sure you're exercising for your health. You know, even sometimes just taking mental breaks too. So if you need to take a day off work, that's also part of your health. Make sure you're keeping sane. You know, I think that that's something that some people don't think about. So, you know, if you have questions, concerns, or anything that you have, reach out to your primary care physician. They are always there to help you and guide you and give you resources you need to make sure that you're up to par with what you need to be. All right, I hope this is helpful, and I hope y'all have a wonderful day. Thank you so much.